Hey, I'm Christian Stanley, and I'm here to talk about the cost of universal healthcare, or rather the benefits of the cost of universal healthcare. So, universal healthcare is like I guess like to kind of sum it up real quick, is that it's healthcare to every legal citizen in the country. So, because I'm advocating for it in the U.S., it would be for every legal U.S. citizen, and this is essentially like stuff like hospital services, emergency room, and they get access to these whether they can pay for it or not. Um, because as of right now, if you cannot pay, well, you might still be served, but you're going to be in serious debt and in serious trouble if you can't pay your hospital bills, even though it is quite like it's your life on the line a lot of the time, or at least like a serious injury or some kind of issue. And this is because healthcare will be no longer controlled by businesses, or I guess not really businesses. It would be no longer privatized, and it would instead be controlled and distributed by the government. So in Rue Noon's book, I'm saying that horribly, but they're a professor, and they wrote a book about healthcare as well, like and they essentially they had this really good quote here that says that having universal healthcare is essentially like a good part of a equal society, of like an equal and inclusive society, because um, essentially I didn't put all of it in here, but essentially saying that like if you only have healthcare for like the richer classes or like the more wealthy classes, that well that's kind of like segregating well-being, and yeah, that's really really messed up, and yeah, that's absolutely not okay. And the thing is that it should be a human right, at least for citizens of the country. Ideally, it would be for everyone, but I think getting it for citizens of the country first is a logical first step. And the reason why that's good is, or why it should be a human right, is because, well, it's your life on the line. You shouldn't make a business, or you shouldn't be charging people or profiting off of their livelihood. And what I mean by that, or one really good way to show that, is something that's commonly, or at least I call the snowball effect, of someone has an issue, a medical issue. They, I don't know, have some kind of pain or have some kind of issue, and they are of a lower class or lower income, or maybe they're in debt or whatever, and they know that if they go to a hospital, then they cannot afford it. Maybe they just maybe it'll just be inconvenient for them to pay, and they just try to tough it out, muscle through the issue, and just keep trying to go on with their lives. Um, Now the problem is that is it still going to be a medical issue? Sure, there's a chance maybe they'll find some kind of home remedy and it'll go away, or maybe it'll just heal naturally. But what will probably happen is that the issue will get worse, and they're going to have to go to the emergency room, which is more expensive. So they're going to have to end up paying more money than it would have otherwise. And keep in mind, this is already somebody who probably couldn't really pay for healthcare in the first place. But now they have to decide whether they're going to live and pay a ton of money, or uh, you know probably die, or at least suffer for this issue for um, well, you might have the issue be worse. And so obviously they're probably going to have to maybe sell their house, go into debt somehow or another. And not only this, but because they waited to go to the emergency room, their issue is going to be worse than it would have been if they just went when they felt bad. And this could commonly mean that something that was non-terminal could have evolved into something that is terminal, and that is of course very very bad. And all that happens because healthcare is privatized and it's very expensive. If they were just a citizen who could just have access to it at any time, this would all be avoided, and it's something that's very common. And one thing that you actually don't hear a lot is that universal healthcare has a lower overall cost, not just for people, obviously, but also for like the actual institutions of healthcare, because, like I've said a million times, it's no longer a business. And well, if it's no longer a business, then then they don't have to compete with each other. And this is a very good point brought up by Mint.com. I didn't cite them here, but they're my works cited. Um, and that yeah, it's they're when you're competing with other like healthcare like services, I guess I'll call them, uh, you're trying to like, I don't know, like get the best price for things, trying to get the most out of people. But if not, then like if you're just a government trying to do it, then you're just trying to get it to people as as cost efficiently as you can. You're not worrying about all this business mumbo jumbo. You're just trying to get it to people as best you can. And yeah, I think that's a very good way to sum up why healthcare or the cost of universal healthcare is a very good reason to advocate for it because overall it's very good for people. Thank you.
Hello, my name is Cody Herbert, and today I will be talking about why healthcare in the United States should be universal. I decided to start my research by looking into Europe, and I found an article called "How Does the Healthcare in Europe Work?" And I found a lot of interesting things. I found out that they don't all have the same healthcare system. In fact, each country has a different one. There's no two that are alike. And that got me thinking that if everyone has a different form of universal health care, then why can't we? It's not as restricting as we might have thought it was, and it's actually a lot easier to accomplish than we thought. The similarities between all of the countries with universal health care in the European Union is one, everyone is included in that healthcare system, and two, it is funded with employers and the public's tax dollars, which could be a big set off to a lot of people in the States. However, we do pay a lot of taxes, and it's just being put towards the wrong things. So I don't see why our taxes would have to go up too much to um, make this goal realistic. I think that universal healthcare has a misconception that it's going to cost a ton of money and all that. And I know that the taxes would probably go up if we decided to do that here. However, that's the cost of a life for some people that can't afford the healthcare that we get. Um, and each different country figured out a way to get their insurance involved, get the doctors involved, and um, get their hospital systems back up to date. That just you can be really creative with this issue, and we don't have to be as extensive or as um, we don't have to have as much tax dollars go into it as some of these other countries. We can still get everyone health care for a cheaper price. It might not be as good as the European countries because I get that they are smaller and don't have to worry about so many people. However, if we all were to chip in, it would be beneficial. I also found that the life expectancy in Europe is 81.3 years old, while in America it's only 78.79 years old. That's a 3-year difference about, and it's kind of a big average average jump in terms of life expectancy. So yeah, all healthcare should be universal. Thank you.
Hi, my name is Jeff Kelcher. And before I begin with my debate topic, I want you to just take a second. I want you to think of someone you know or someone you care about. And I want you to ask yourself, how much are you willing to pay to keep that person healthy or even alive? This is a funny question, right? But these are some of the questions that some people are having to answer. According to Balance Everything, around 530,000 Americans filed for bankruptcy due to medical bills. 66% of those were due to one accident alone or medical event. while France, who offers universal health care, has virtually no medical related bankruptcies. This is why we need universal health care in America. I mean, America, the United States, we're the wealthiest, one of the wealthiest, most prosperous nations in the world. Yet our government is unable, unwilling, or incapable of providing adequate basic health care to our citizens. As an American, we have a moral duty or an obligation to protect the citizens, not just those that fall on the opposite spectrums, like the super rich who can afford anything, or the super poor that can't afford anything. But it is everybody in between. It was Emil Kant who said that all rational beings have dignity and should be respected. So why don't we have universal health care? There's been many false accusations. Wait times too long. New tech and innovative procedures will dissipate because of private practices going away. And then the most important, expense. But did you know that Americans pay about $10,000 a year from the World Health Organization, saying, and most other countries spend about $2,000 to $5,000 a year. That is nearly double or triple what other countries are paying for health-related procedures. But so how are we going to pay for all this? There's three, even though, as my partner Cody said, there's many ways, unique ways to pay for that. Every country has their own way of paying for it. But there's three basic models. First, there's the socialized medicine model, which the government comes in, takes over, and employees like myself would become federal employees. There's the single payer or the Commonwealth, what we use, England uses. And this is based on how much you make and the negotiation of the government with that provider and with those companies. And then there's what we use is out of pocket. By raising taxes and by contributions from your employer, by mandating contributions from your employer, we would be able to provide health care for people in this country. So, as you can see, I am in Scrubs. I work for a healthcare facility. I see people's struggles. I see people and hear their stories of accidents and how their life has been turned upside down because of this accident, and what waits, besides trying to get healthy, what waits outside of these hospital walls is what scares them the most. I myself have personal experience. I had surgery on my leg. If I did not have health insurance, I would have paid $78,000 for that leg. I still paid quite a bit of money for this surgery, but it was not $78,000. Isn't it our country's motto? Liberty and justice for all. But just don't break your leg, because we will charge you for it. So by helping everybody together, using more of an altruistic kind of theory, we're going to help the betterment of more than just of everybody, of the common good. That is why we need universal health care. Thank you.